Thyroid cancer rates are skyrocketing in the United States and around the world. In this study, we aim to further delineate thyroid cancer incidence trends using the Rochester Epidemiology Project, or REP, with an emphasis in understanding the incidence of what we call more clinically relevant thyroid cancers, or those with more aggressive behavior. We found that while thyroid cancer incidence is increasing, there is no significant change in incidence of clinically more relevant thyroid cancers over more than 80 years of observation. Hello, my name is Dr. Natalia Gennari, and I'm an instructor in medicine at Washington University in St. Louis. It is my pleasure to present incidence of clinically relevant thyroid cancers remains stable for almost a century, a population-based study, which will be published in Mayo Clinic Proceedings in November 2021. This study was conducted in collaboration with my colleagues in Mayo Clinic Division of Endocrinology and beyond, Drs. El Khoury, Rachel Giblin, Dr. Vaccarella, Dr. Morris, Dr. Hay, and Dr. Brito. As part of this study, we looked at 596 individuals who were diagnosed with thyroid cancer between the years of 1935 and 2018. We collected information about their clinical, pathologic, and surgical findings for each thyroid cancer using the Rochester Epidemiology Project. We defined clinically relevant thyroid cancers to have one of three features. One, that they have aggressive histology or distant metastatic disease at the time of presentation. Two, primary tumors more than 4 centimeters in size. And 3, primary tumors found to have gross invasion upon surgical intervention. We found in our study that the median tumor size was 1.5 centimeters, and 89% of thyroid cancers diagnosed over this time were papillary thyroid cancers. Summary of our findings are depicted here. In the gray line toward the top of the screen, you'll see the incidence rates of thyroid cancer, which are increasing over the observation period. Specifically, we found a per decade increase in thyroid cancer of 24.3%. Mortality, depicted in the black line, was unchanged over the study period. Now, in the different color lines in between, this looks at incidence by various types of clinical relevance that I just mentioned to you previously, and there was no statistically significant change in incidence by any of these 3 criteria of clinical relevance. So, we conclude that while thyroid cancers are increasing in frequency, this change is primarily caused by diagnosis of more clinically indolent cancers and low-risk thyroid cancers, and that the rates of these more aggressive clinically relevant thyroid cancers is unchanged over this time period. So, how do these findings impact clinical practice and patient care? Well, one, this study and others show that thyroid cancers overall carry an excellent prognosis. We need to share this information with our patients to provide them individualized guidance about their survival and recurrence risk, and this should be a means of reassurance for most patients. Second, because we know that the incidence of low-risk thyroid cancers is increasing, we can anticipate that the needs for thyroid cancer survivorship care will also continue to increase both in academic institutions and in community practices around the country. We also need to develop evidence-based best practice guidelines for how to deliver the best thyroid cancer survivorship care for individuals with low-risk thyroid cancer. Further research is needed for optimization of thyroid cancer monitoring protocols based on cancer subtype and recurrence risk, as to provide each patient the best monitoring recommendations possible. We hope that you enjoy reading the full article, and I thank you so much for listening.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.